today's video, we're going to be talking about common questions about Medicare supplement plans, Medicare Advantage plans, and Medicare drug plans that some of my clients have asked me over the course of the year. So what I did is I compiled all these questions and I'm going to explain to you what the answers are in case you also have the same questions about the different type of plans. So let's start with the questions about the Medicare supplement plans. Let's see what the first question says. This is from Jane from Arizona, and it says, are all Medicare supplement plans the same that have the same letter? And the answer is yes. If you buy a Medicare supplement, or if you're looking at a Medicare supplement plan of a letter in particular, let's say a Plan G or a Plan N, all the Medicare supplement plans of the same letter will be the same no matter what insurance company you select. The next question comes from Mary from Texas, and the question is, are all the prices the same? And the simple answer is no, they're not the same. Every insurance company set their own price points and they're all different. Although the plans are 100% the same from company to company, the pricing is not the same. The next question is from John from Arkansas. And he wants to know if he can change the plan, the Medicare supplement plan, at any time, or if he has to wait for the AEP, or annual enrollment period, at the end of the year. And the answer is no, you don't have to wait. If you have a Medicare supplement plan and you want to change it for another Medicare supplement plan, or if you just want to cancel it, whatever you want to do, you can do it at any time during the year, and there is no election periods. The next question is a little more complicated, and it comes from Jane from Kansas. And it says, or the question reads, do I have to medically qualify? And the answer is, it really depends. And it depends because if this is your first time going on Medicare in your initial enrollment period, you don't need to qualify. You will qualify for a Medicare supplement regardless of your medical condition. However, if you do it at a later time in your life, after the initial enrollment period, yes, you will have to qualify. Also, if you leave your employer and you leave your employer's plan, health plan, you will also be able to qualify into a Medicare supplement plan without having to medically qualify for it or without having to answer any medical questions. This question comes from Jim from Texas, and he wants to know, can I go to any doctor or any hospital with a Medicare supplement plan? And the answer is very simple on this one. As long as your doctor accepts Medicare, and as long as you go to a hospital that accepts Medicare, which I believe is all of them, you can go to any doctor or any hospital that you want, because there are no networks with Medicare supplement plans. You can go to any doctor or any hospital that is a Medicare provider. Here's a very common question. This one comes from Laura. And the question is, do Medicare supplements include dental, vision, and hearing? And the answer is no, none of them do. However, that doesn't mean that you can't get it. What it simply means is, if you have a Medicare supplement plan, you can buy a standalone dental, vision, and hearing policy, but it will not be part of your Medicare supplement. Next question, do the benefits change year to year? And the answer is no. On a Medicare supplement plan, the benefits will stay the same, and that's the beauty of those kind of plans. On Medicare Advantage, they change every year. On Medicare supplements, they must and will stay the same and will not change every year. Will my supplement cover me if I need to go to a nursing home or assisted living or a skilled nursing facility? Well, that's kind of like a complicated three-pronged answer, but I'm going to try to make it as simple as possible. If you need to go to a skilled nursing facility, your supplement will cover you for that. If you have to go to a nursing home, neither your supplement or your Advantage plan or any other plan, unless it's a specific plan to cover long-term care, then your supplement or Advantage will not cover you for a nursing home. They will cover you for rehab, but they will not cover you for a nursing home. None of the plans. How do I know if my doctor accepts the Medicare supplement plan? Well, that's a simple answer. If your doctor accepts Medicare, he will accept your Medicare supplement plan because doctors bill Medicare directly. Medicare pays their portion, and then your doctor will pay the balance of the bill less the deductible that you have in your plan, if you have a deductible at all. The next one is a very good question for people that do a lot of traveling within the United States or offshore. And the question comes from a client that wanted to know, do they cover me when I travel outside of my state where I reside? And the answer is yes. They will cover you anywhere in the United States, no different than they will cover you at home, because there are no networks, so there's no geographical boundaries of where they cover you or where they don't cover you in the United States. If you're in the United States, no matter where you travel, you will be covered by Medicare and your supplement plan. However, if you travel offshore, it's a little more complicated than that. And Medicare and the supplement will cover you when you're offshore. However, the problem resides in the fact that offshore, depending on where you go, they may not accept your plan. They may not accept or recognize Medicare. So you will be covered, but be prepared for the possibility that you may have to pay for your expenses out of pocket and then seek your refund when you get back home. Oh, here comes a big question. And the question is my rate going to go up? And the answer is yes. All Medicare supplement rates do go up. Normally, they go up once a year in the policy anniversary date, which means the date that your policy started. So you can expect to get a rate increase pretty much every year on the anniversary date of when your policy started. Do they all go up the same, every insurance company? No, they don't. Some of them go up higher than others. Some companies are better at keeping the rates low than other companies. So it is important that you select the right company, and that way you don't face so many rate increases throughout the years. Do supplements include prescription drug coverage? The answer is categorically no. No Medicare supplement plan includes your drug coverage. So if you have a Medicare supplement plan or you're thinking about getting a Medicare supplement plan, it is important that you also buy a prescription drug plan along with your supplement. Otherwise, you will have no drug coverage. So now that we're done with questions about the Medicare supplement plans, let's go ahead and go with the questions about Medicare Advantage plans. And the first question that I receive, which is a very common question that I get all the time, is, are all Advantage plans the same? And the answer is, unlike on Medicare supplements that they are, Medicare Advantage plans are all different. Even within the same insurance company, you may have 5 or 10 different plans for each county, and they will all be different. You will have PPOs and you will have HMOs, and you would have a multitude of PPOs and a multitude of HMOs. So you will just have to determine between yourself and your agent or broker which one is best for you. And you will have to go through all the benefits, all the copays, and everything else, and then make a determination. Oh, and your doctors, by the way, because you got to make sure that all your doctors are in the network. And that way you make sure that when you go to your doctor, you're not going to find a nasty surprise saying that he cannot see you because he's not part of the network. So again, the answer is categorically no. All Medicare Advantage plans are different, even from the same insurance company, even within the same state and the same county. You will see that there's hundreds of plans and they will all be different. Another common question that happens, and it pops up all the time, is, if I am moving to another county or another state, do I have to change my plan? And the answer is 100% yes. If you move to another county or if you move to another state, you will have to change your Medicare Advantage plan. You will have to select a plan that is for the county or the state that you're moving, and then narrow it down out of the dozens of plans that are there, which one is better for you. You can't just move and not notify the insurance company or your agent, because you will be disenrolled out of the plan if you're using a plan that is outside of your area of residence. So if you move, all you have to do is call your agent and the insurance company, notify them of the move, and then you will have to, again, look at a plan that works for you in the new area that you're moved. Next question. Can I change my plan at any time, my Medicare Advantage plan, at any time? Well, the answer is definitely not. You can change your Medicare Advantage plan. You can buy a new one when you first go on Medicare, or you can change it during the annual enrollment period, which is October 15th through December 7th every year, and the changes will take effect on the following year. Or you have one more opportunity to change it, which is between January 1 and March 30th every year. You're able to make one more change. If you made a change during the AEP and you're not happy with it, or you decided that you made a mistake and you would like to go with another plan. Do I have to medically qualify for a Medicare Advantage plan? And unlike on the Medicare supplement plan, on the Medicare Advantage plan, you do not need to medically qualify. So you can simply talk to your broker or your agent, do an application on the Medicare Advantage plan. There will be no medical questions whatsoever. And if you're trying to change during the correct time of the year, AEP, OEP, or the first time you go in it, you will not have to fill up medical questions and you will qualify. Can I go to any doctor or any hospital like on a Medicare supplement plan? The answer is definitely not. You have to make sure that your doctor and your hospital are in the network to be able to go there. Now, if there's an emergency or anything like that that pops out and you're taken by an ambulance or you're taken to the emergency room, then the boundaries are not valid anymore, meaning that if the ambulance or if they take you to the emergency room in a hospital, that is not part of the network. That is not going to be an issue with you, because the being in network or out of network doesn't count if you go into the emergency room, if you need emergency services, even if they take you to the wrong hospital. Do all plans include dental, vision, and hearing? And the answer is no. Some of them do. Some of the Medicare Advantage plan include dental, vision, and hearing, but not all of them do. So if you need that, you need to make sure that you read the summary of benefits and that they do include dental, vision, and hearing. And again, some of them do, some of them don't. So there really is not a right answer other than check your summary of benefits and see if they do. Can I buy dental, vision, and hearing if I have a Medicare Advantage plan and they don't offer those benefits? And definitely, yes, you can do that. If your Advantage plan does not offer those benefits, you can buy the dental, vision, and hearing a la carte by themselves. Do all plans offer transportation and meals? The answer is definitely not. Not all Medicare Advantage plans offer transportation and meals. Some of them do, most of them don't. So the short answer to that is no. Can my benefits in my Medicare Advantage plan change in the following year or from year to year? And the answer is yes, they can and they will change. In fact, it's very rare that you see a Medicare Advantage plan that doesn't change something from year to year. I read the summary of benefits on my clients that are trying to change. And yes, they will change from year to year. Some of them will change for the better, some of them will change for the worse. But what you can bet for sure is that the benefits on a Medicare Advantage plan will change year to year. And that's why it's so important that to review your plan every year with your broker and make sure that if there are changes, that they are positive changes that you like and approve. Will my Medicare Advantage plan cover or pay for my skilled nursing facility? And the answer is yes, they will pay. Limited pay, but they will pay or help you pick up at least part of the bill. Are they going to pay as much as a Medicare supplement? Definitely not. Are they going to pay something? Yes, they will help you pay for the skilled nursing facility. Will they pay for nursing home? Would I be covered for that? The answer is definitely not. Medicare Advantage plans do not pay for you to be on a regular nursing home. And neither does the Medicare supplement. If you want to, or if you need to go into a nursing home, to live in a nursing home permanently, then you're either going to have to pay it out of your own pocket, or you will have to purchase a long-term care policy, which are really expensive. How do I know if my doctor or hospital takes the plan? Well, there's really no easy way to know this. You will have to either ask your agent or broker if your doctor takes the plan. Hopefully, your agent or broker did their job well and they checked before they put you in the plan. So that is very important, that you check your doctors and the hospital. Will my doctor be covered with my Medicare Advantage plan? Well, you're going to have to ask your doctor or check with your agent, hopefully before he puts you in the plan, if he accepts that particular insurance company and your plan, whether it's a PPO or an HMO, whatever it is. You will have to find out you can either ask your broker or agent, you can ask your doctor, you can call your insurance company, or you can check in the website for the insurance company and see if your doctor is a provider in network. Or maybe your doctor accepts the plan but is a provider of the network, which unfortunately means you will have to pay extra if you want to go see the doctor. My prescription drugs covered with a Medicare Advantage plan? Well, the answer is if you bought a Medicare Advantage plan with prescription covered, yes, they will be covered if they're in the formulary, meaning the list of prescriptions that they're approved within the company that you sign for. If you sign on a plan that does not include your prescription coverage, then they will not. Are there any limits of what I have to pay out of pocket with a Medicare Advantage plan? The answer is yes. They do have a cap. They're all different. Every plan is different. It's called a maximum out-of-pocket expense, and they can range anywhere between a $500 maximum out-of-pocket expense all the way up to $9,000 maximum out-of-pocket expense. And what is that? That is the portion of the plan or the portion of the bill that you are responsible for. And once you reach that part, then your insurance company will take over and pay for the majority of your expenses. Finally, we're going to be talking about the Medicare Part D or drug plans. The first question that I get all the time is, are all Part D plans the same? And the answer is no. They're all different. They all have different costs. They all have different deductibles. It could be $0, it could be $250, or it could be the standard Medicare deductible of $545. So you have to check with your agent or broker and find out what they are. If they have a deductible, how much the deductible is, and you definitely have to check the formulary to make sure that all your prescription drugs are covered in the formulary, and hopefully that they're all in a lower tier. Because as you know, on prescription drug plans, they are divided in tiers. Tier 1, 2, 3, 4, 5. And the rule of thumb is the lower the tier of your drug, the less that you're going to pay for it out of pocket. So you always want to try to make sure that most of the drugs that you take, they're either on tier 1 or 2. And I know sometimes that's not possible. But again, the more prescription drugs that you have that are in the lower tiers, the less you're going to pay out of your own pocket. Will all my drugs be covered by my plan? And that's kind of like a hard question. I don't know. You will have to go again with your agent or broker or insurance company, put all your drugs in your profile and check and make sure that they are drugs that are being dispensed in the formulary of the insurance company that you select. And we're getting to the end of the video. So the next question is, can I go to any pharmacy? Well, yes, you can go to any pharmacy. However, there are pharmacies that are in the network of the insurance plan that you select, whatever it may be. You have network pharmacies and you have no network pharmacies. If you go to a network pharmacy, chances are that your prescription that you're taking will be lower in cost than if you go to a non-network pharmacy. And so the other question, which I really don't have to answer because I already did, is, are network pharmacies cheaper? Most of the times, they are. What happens if my doctor prescribes a prescription that is not in the formulary? Well, it's very simple. Either your doctor will have to change the prescription and give you something that it is on the formulary or the list of medicines that you have within the formulary of your insurance company, or you're going to have to pay full price for that medication. There's no way around that. Is my prescription plan or Part D plan going to change next year? And the answer is most likely yes. All prescription drug plans and Medicare Advantage plans change from year to year. So even if you feel very comfortable with the plan that you have, you should always check and make sure that there is no changes that will affect you in an adverse way. Perhaps your plan changes for the best, but perhaps it doesn't. So it's important that you check your plan, your cost of the drugs, and your formularies every year. My name is George Ibanez. I'm a licensed insurance agent. I am licensed in over 40 states. And if you have any questions, please leave them in the comment section. If you like the video, leave me a like and subscribe. Or if you have a question that you feel that it would be better if you would speak to somebody, give me a call and I will be happy to help you.